Here are some of the results. It's based on these 3 articles. This is the 30 months follow-up data. So they have been published between 2010 and 12. Here are the neurological findings at 30 months. You can see that as much as 14 patients did have mild neurological findings, like respirasis, paresthesia, and things like that. But that was not their main complaint. Their main complaint was the subjective symptoms like fatigue, memory, and attention problems in 19 of the patients. So then we looked at quality of life compared to the matched group of patients. There was a significant difference on the SF-36 for both the physical and the mental quality of life. The patient scored lower. And here are more results. Fatigue was significant different, and you can see depression was also significant different from the groups. But if you are you know this MADRS score, you can see that the points are so low that depression was no problem among the South Norwegian population or the patients. So apathy was also different in the 2 groups, but if you looked into significant apathy, there were no difference between the groups. So from these assessments, fatigue is the most important thing to look at. So here you see a box plot illustration of the fatigue distribution from the scores from the fatigue severity scale. And what it tells us is the first column there with the patients, that there are significant more patients in the group of significant fatigue over 4 on the score, and also scoring more than 5 on the scores. There are 16% of the controls also complaining about fatigue, and I think that's important. But when people talk about my study, they say that 50% of the patients did have complaints, but 60% of the patients does also have complaints. So this is statistics. So, but it's more patient without doubt. And also in the group with severe fatigue, there are 2 patients, but they have other disabling disease like a chronic cluster headache and a post-polio syndrome known to also cause fatigue. But these are average people. So here are the results from the neuropsychological tests. And then we can see that the 4 red arrows are pointing on the tests that were significantly different from patients and controls. These are the difference from the mean in the control group, how much poorer or better the patient scored from the mean in the control group. And you can see there's 2 tests where the patients scored better than the controls, and they are not significant. So all over the patients are scoring worse in 1 test for executive function, 1 for processing speed, 1 for visual, and 1 for verbal memory. So what does this mean? Does that mean that all the patients are scoring a little bit worse, or does it mean that some subgroup of the patients are scoring worse, substantially worse, giving them an impairment in neuropsychological functioning? So then we had to look into the data in a different way, and we took this global neuropsychological score that I told you about and counted the bad scores in the patient group and the control group, and made 4 different categories, where the green is where they scored normal, deficit 6 to 8 test scores worse, and impairment 9 to 23 poor test scores. And then we made column diagram to show that the first column is the patients and the second is the controls. And what we can see that there are no significant difference between the patients and the control scoring normal or with a deficit. But in the group of impairment, there is a significant difference. 1 patient scored had so low scores that we could call it an impairment, and 8 patients. And the 1 control with so low scores, we think he was developing an Alzheimer's disease. So here is something going on. We also looked at the risk factors and found that if you have symptoms more than 6 weeks before treatment, or you have a more severe disease before treatment, or you are not getting well at 4 months, then you have a greater risk to have complaints also 30 months after treatment. Now I wanted to show you the spinal fluid findings 30 months after treatment. We did unfortunately not have the chance to look into this in more than 29 patients because accident at the lab. But we found that one patient had a raised cell count at 30 months. And this patient had a new infection with a Borrelia. I could tell you a lot about that, but we did a new treatment and this signs disappeared then. But what you can see making it difficult for us is that it's still a high protein level in 1/3 of the patients. The anti-Borrelia antibody production is still there in 61% of the patients, and the only clonal bands are also there. But we didn't find any signs of persistent infection in our study in the way it was designed. And we also did not find any associations between the spinal fluid findings and the results of the tests we did do.